Hi, I'm Dr. Melanie Palm from Art of Skin MD in San Diego, California, and today we're going to be talking about Vollure. Here we go with my Vanna White hands. And this is the newest product that has been FDA approved from Allergan. So it's actually from the Juvederm family. It's a hyaluronic acid, but it has something called Vicross technology. So things like Voluma, which came out a few years ago, Volbella, which we use in the lips, and now Vollure, they're all based off of this same technology in how the hyaluronic acid is sort of complex to itself. So it gives pretty flexibility, it's nice and smooth, but it may last a little bit longer because of how it's complex, but it is completely biocompatible. Our body breaks it down over time. So we have a wonderful patient here that I think is an outstanding model for what we want to use Vollure for. So it's really somebody that just has a little bit of soft, subtle fold, what we call the nasolabial folds, that we want to soften the area. And so I'll actually have her animate as we're filling. Other areas that I think Vollure can be great for is marionette area, if you were filling out softly an earlobe. When patients lose fat, especially after facelifts and sort of the side of the face, I think this is going to be a great area to just give smooth, even, pretty coating to that area. So without further ado, we're going to do a little bit of filling. There's actually, the patients had some topical numbing, and there's actually numbing that's pre-incorporated into the filler. I'm going to have you lift your chin up for me. So I'm going to do a little bit of a spicy poke right next to her nose. It's a little spicy poke on 3. 1, 2, 3. And I know that kick has a little bit of kick, and I'm sorry. So this is an area called the piriform fossa, and it's really important that we're injecting right on top of bone with this. And I also like injecting here first because the little nerve that starts in our cheek that runs down towards this area, we can often give a little bit of numbing through the filler there first. And that makes subsequent pokes, little teeny poke, a little bit easier. You know, and on a patient like this, I'd probably just use 1 syringe. Typically, there's a little bit less swelling with some of these newer products, the way they're complex together to one another. And I think it's really important as an injector that you just go slow and steady. And that's it. We're actually done with this side. So we'll actually come straight on to the patient so you can see right side of her versus left, and you can see how we've just been able to soften that line. You can see a little bit of shadow here, and especially in beautiful Asian faces such as this patient, there's a tendency to have some flatness in the mid face. So I think this is a really nice application to be able to rejuvenate a younger face where maybe she's just noticed a little bit of change over time. So if you've got any other questions about Vollure, it's got the cool purple syringe on it. Give us a call at Art of Skin MD. It's 858-792-7546, or you can check us out on the web. It's artofskinmd.com.